Well, good morning, everyone, and happy National Palliative Care Week. And today is Wednesday, and we've got a beautiful webinar today with some lovely people sharing their knowledge and wisdom in this space. And it's a really important topic on palliative care needs of First Nations people. So thank you for coming along this morning, and thank you for listening and learning and sharing with us today. My name's Shyla. I'm the CEO of Palliative Care Queensland. And we're delighted to have this topic today, and we have two wonderful guest speakers as well. And I'll first hand over to Kat, who will do an acknowledgement of country. Thank you, Kat.
Thank you all. I'm coming to you today from Wulgarukaba and Bindal country here in the beautiful Townsville. So I'd like to commence by saying, acknowledging the opportunity for us all today to give this beautiful space in this platform for the voice of Aboriginal and Torres Strait Islanders to be heard and further explored. I acknowledge those that identify or are of Aboriginal and Torres Strait Islander descent joining here with us today. We acknowledge the traditional lands on which we live, learn, love, work, heal, grow and play. We acknowledge the wisdom of ancestors who walked our lands tens of thousands of years ago, and the knowledge that transpires from this past in those of our current and our future generations. We acknowledge the significance of our lands, the plants, the animals and the seas in our creation and our dreaming stories. We acknowledge the strengths that walk with us in these stories and that also unites us, our families and our communities. We acknowledge the great resilience, the peace and also the forgiveness that is evident to heal and unite our present and our futures from our past. We acknowledge that we are all healing, we're all growing, and we're all trying to reclaim connections, both past and present, to both nurture and commit to empowering the health outcomes for our Aboriginal and Torres Strait Islanders. We acknowledge the hard work and the dedication of all of us here and present today in one form or another when faced with the evolving challenges of the global pandemic. I thank you all so very much and acknowledge the significance that each one of you have here today and the time that you give, your leadership and your dedication in driving all of this beautiful and positive change.
Wow, thank you so much, Kat. That was absolutely beautiful. And yeah, thank you. Just so much words of wisdom in that space. Really appreciate that. So what a privilege it is for us to talk in this space and listen and learn like we discussed. This session is put on by Palliative Care Queensland. So we're the peak body and leading charity for palliative care across Queensland. And we're also supported by the other jurisdictions across Australia for this session as well. And obviously Mark is one of our speakers today. He's from Palliative Care South Australia. And it's the opportunity for us all to work together on the national front as well. So really excited to collaborate. So PCQ believes that the way we care for our dying is a significant indicator of the kind of society we are. Our organisational priorities are that all Queenslanders are able to live every day until their last, are able to have a dignified death regardless of illness, age, culture or location, and have access to a supportive social network at the end phase of life and the choice of quality palliative care. And this is very similar across all the jurisdictions. So although we say Queensland here, it's very relevant to all people and everyone, because this is really important in this space. And then the topic we're focusing on today helps to bring all this together and helps to move those priorities forward as well. So we'd just like to acknowledge the support and sponsorship of today's event. So PalCare software has supported these events, these webinars regularly in this space, and that's a specific software for palliative care. Our SELT-T project, Connecting End of Life Care in Townsville project, which is funded by Northern Queensland Primary Health Network. Mingari Care, which is a hospice community support project in the Sunshine Coast. And our Ambulance Wish Queensland program as well has supported this to be accessible to paramedics as well. We'd also like to thank all the jurisdictions and Palliative Care Australia for supporting and sharing this throughout their networks. So just a quick touch of housekeeping, although I know most people are pretty good at Zoom nowadays and all these online platforms. But just to mention at the bottom of your screen, and also recognizing some people will be on different platforms. So when I say bottom, it might not be there for everyone, but just recognizing that there's a chat function and a Q&A function. So we'll be doing the presentations and then after that working into a Q&A area. So please pop any questions that you have in the Q&A button area, or if that's difficult to find, don't worry and just pop them in the chat function. That's absolutely fine as well. So just to test the chat function, and I can already see how fabulous everyone is already jumping in there. So amazing to look at that. If you have a chance to jump into your chat function and acknowledge the lands, the local Indigenous lands that you're on today, it gives us a great opportunity to share. If you're not aware of which ones they are, you can put the name of the suburb or the other location there as well. It's a great way on an online platform like this to share and see all the different people. We're fortunate to see that over 60 people are already online, which is lovely. So we can see that, but we never know where people are unless you pop your name in there. So I'm fortunate to be in the Yagara and the Turrbal people in the Brisbane area as well. So we'll see lots of people pop that in there in the chat, and that'll get us seeing that it's working. So you can see, beautiful. And it's really wonderful to see so many people from so many locations. So thank you very much. So Palliative Care Queensland focuses a lot on policy areas, and we've just launched a new document called the Priorities for Palliative Care in Queensland. Last year in November, we held a roundtable on palliative care for First Nations people, and the outcome of that is published in our priorities document, which we call a hot topic area. And you can see the key improvement areas that are identified from that roundtable. The purpose of this document and our other publications is to be our policy agenda for the next 12 months, and also to encourage the limited resourcing in palliative care to be focusing on a similar direction. So utilisation of those limited resources in a collective effort to drive some system change and system improvement as well. So this is actually what we've developed in regards to the key improvement areas from this hot topic area. So we'll share that with everyone after as well. And we encourage all other people to consider what are your key improvement areas in relation to this and in relation to what will be discussed today. So next slide, please. It is National Palliative Care Week, and the theme for this year is It's Your Right. So we believe today and for this week to focus on all different rights of palliative care. Our theme that we're focusing on today is that palliative care, it's a right to die on country and lands that matter to me. And we'll be focusing on that with our guest speakers today. Our advocacy message in Queensland, each of our advocacy topics that we've chosen during National Palliative Care Week is linked across to our pre-budget submission to the government. And our pre-budget submission in Queensland says that we need a clinical centre for excellence for First Nations palliative care. And we're constantly advocating for that in this space. And it's something that we'd really love to see driving forward and create some system change from that level of clinical and also research area as well. So we'll keep that message going. And if you have a chance and you live in Queensland, please try and write to your local MP and ask them to focus on this and tell them how important it is and that we need it. So thank you. So now I have the privilege of actually introducing two amazing people. I'll start here with Kat. So you've already met Kat briefly there, but Kat is a proud Wurundjeri, I'm not very good at pronunciation, so I apologise, Wurundjeri woman. And Kat is an endorsed nurse practitioner. She spent her early career as a nurse working in the remote areas of Oakleigh, Chinchilla, Roma, Dalby, Miles, and working alongside Queensland Ambulance in retrievals, public health, mental health, and emergency response teams. She's also worked as St Vincent's Community Palliative Care, Karuna Hospice Service, and is now at QUT. She's also a member of PCQ's Reconciliation Action Plan Working Group and a great advisor to us in this space. So really appreciate that. And thank you. I'll hand over to Kat now.
Thanks so much all, and thanks for the honour of allowing me to be present here with you all. Just to further check out this chat function, I just wanted to bring your attention to a couple of beautiful resources that are available to everybody, just to further enhance knowledge and to really empower and support you guys out there in your practice. So some websites to check out, if we can load those links up, would be the Gwendolyn Project, a beautiful national project that is available for us. We've got iPepper and Pepper Aged Care, and a really beautiful project that's available that are bringing out some amazing resources. So please check them out, is the Caring at Home project for Aboriginal and Torres Strait Islanders. All of these projects really align with what we're going on about today, is the facilitating the right to die on country or lands that matter. So yeah, please utilise those resources that are available. They're incredible. So next slide, please. So Aboriginal and Torres Strait Islanders, I feel, are like an endangered species. Within palliative care, currently the rates of access are averaging around 1.3% throughout Australia for our Aboriginal and Torres Strait Islanders. And considering the aged, standardised complex disease burden amongst Aboriginal and Torres Strait Islanders is disproportionately higher, at around about 2.3 times the rate when compared to non-Indigenous Australians. That's pretty significant. Now, this data shows that there is disparity for those who could benefit, Aboriginal and Torres Strait Islanders that could benefit from approach to care, a palliative approach to care, when compared with those rates of chronic disease, the cancers, the comorbidities, and also in addition to that now, the life expectancy of Aboriginal and Torres Strait Islanders. Now, I am really proud as we embrace and we try to facilitate that it is a right to die on country and the lands that matter to each person. And I'm always hearing of stories of return to country or lands that matter most at the end of life, but yet I still think there's so much work for us to do. And given the strong connections to community for our Aboriginal and Torres Strait Islanders, their families, and that connection to country as well, I think we all need to make sure that we rally to support this. So today I come to you in an attempt to address that Aboriginal and Torres Strait Islanders are currently an endangered species in palliative care. And with well-researched poor acceptance and uptake of palliative care largely explored in the research, and it is largely attributed to the they mentality. I often have clinicians tell me that they are feeling blamed for past colonisation and wrongdoings, and I feel that we need to shift that they and that them mentality. And today I ask, how informed are you? And this really could help us in shifting that blame and empowering us to be informed and not feeling that blame. We need to develop a knowledge of the communities that we live in like looking at the names and the meanings of the towns and in language that exists around us, local totems and meanings, information about your local towns and cities. For instance, what does Boundary Street mean in the lens of an Aboriginal and Torres Strait Islander? Are you actually practicing cultural humility? And are you aware of your local community's political, historical and social context from the lens of an Aboriginal and Torres Strait Islander, not just a Western lens? And I'm telling you, there is really a huge variance, I can assure you. We need to create trust, we need to earn that respect, and we need to really connect with mob. And those trusting relationships and therapeutic benefits will actually follow. We need to become informed of real Aboriginal history, not colonial history. Now, here is a fact to get you intrigued. Currently, there are over about 46,000 sacred sites that we are aware of here in our beautiful Queensland, right in this very moment. And these are past stories and artefacts for us to begin to learn about and explore. And guess what? Most of them actually existed pre-colonisation. So maybe being aware of a few of these could actually assist us to not feel blamed or ill-informed, but actually feel empowered to connect with Aboriginal and Torres Strait Islanders. And maybe this can then assist us in not casting a they and them mentality stereotype, and that we can actually then see so much individuality and uniqueness that exists. Next slide, please. I feel it's time that we change the negative discourse approaches and look at things from a strengths-based approach, which actually correlates with my current research in social and emotional wellbeing indicators for Aboriginal and Torres Strait Islanders in palliative care. Now, this is a project that I'm proudly working on with St Vincent's Brisbane team and QUT. And I thank you to all my previous beautiful colleagues at St Vincent's that have actually helped and supported me on this journey as well, and my current colleagues. It is time to shift policy design and delivery to maximise self-determined palliative care that empowers every aspect of social and emotional wellbeing. And whilst this is not provided, Aboriginal and Torres Strait Islanders will continue to die disparately and continue to be that endangered species in palliative care. And if we don't address palliative care using this accepted approaches to care, we will continue to see a mirroring of gaps and inequalities, poorer uptake and acceptance of palliative care for our Aboriginal and Torres Strait Islander population. The known disparities that exist now need to go beyond the recognisable catchphrases, and there needs to be an obvious collective effort to embed cultural competence into the care we are delivering and utilise cultural humility to rationalise the consequences of inaction. We need to reframe and use transformational allyship, justice and equity practice that are no longer delivered or considered just add-on approaches. And we need to develop further strategies, obviously, in doing all of these things to eliminate that they mentality. This will actually assist us in reducing power imbalance to encourage Aboriginal and Torres Strait Islanders to become actively engaged participants in their palliative care journeys. We need to utilise the tens of thousands of years of Aboriginal and Torres Strait Islander ways of doing, knowing and being to establish culturally safe and culturally responsive palliative care delivery. Now, these social and emotional wellbeing models are self-determined. They're empowering approaches to shift this they mentality and to ensure that each individual person and person's Aboriginal knowledge directs their own palliative care story. Self-directing means becoming self-active in engagement, which is to become active in self-determination, not an abstract suggestion, but active in being in control, to reclaim what has been lost, to be active in exercising power, and to be active in determining the outcomes and choices of care, to be active voices from each community and family, taking away the negative discourse of they are vulnerable, they are marginalised. And most significantly, we are now addressing these preventable inequalities that our Aboriginal and Torres Strait Islanders experience by drawing on knowledge and experiences of Aboriginal and Torres Strait Islanders themselves. Providing an evaluation of confidence in having a strong and empowered voice is essential in transformative approaches to palliative care for Aboriginal and Torres Strait Islanders. So please come with me and us on this journey, because it's time to be part of this transformative change. Slide 3, please, next one. One message I feel is essential is to capture the effective palliative care for Aboriginal Torres Strait Islanders to be those embedded models that have outcomes of collaboration and reciprocal cultural understandings and knowledge within a broader term of social and emotional wellbeing. Palliative care service delivery and our palliative care practice needs to provide and uphold this self-determination and leadership from Aboriginal and Torres Strait Islanders themselves to culturally define those connections and relationships with each individual, their family and their community as one. Addressing the social and emotional wellbeing includes a broader awareness to roles, relationships, community obligations, the spiritual connection to country and ancestors, and that continuity through laws and dreaming. And this assists us in reclaiming that identity, that sense of self through entwinement with country, community, family, clan groups and relational bonds as an individual, not they approach at the end of life when it's needed most. Next slide, please. So quickly, I'll discuss the principles of social and emotional wellbeing in application to palliative care. And hopefully this will give you some food for thought. So principle 1, health as holistic. Aboriginal and Torres Strait Islander health is viewed as a holistic context that encompasses all aspects, including the mental, physical, cultural and spiritual. Land is central to wellbeing. It must be considered that while the harmony of these interrelations is disrupted, Aboriginal and Torres Strait Islander ill health will persist, and the spirit will have unrest as it approaches the end of life in that cycle and dreaming. Palliative care delivery should be influenced from design, implementation and evaluation process with culturally informed screening and assessment instruments that capture social and emotional wellbeing. And few of those actually exist at the moment and which are actually applicable to palliative care space. And we are now addressing this. Much work in palliative care is needed to investigate and explore the interconnectedness of harmony, balance, reduction of symptoms from a trauma-informed lens, restoring holistic function. Now, this work also requires healing approaches to reduce re-traumatisation of individuals, families and communities at the end of life, to support resilience, life skills and reclaim all aspects that are important and impacting on social and emotional wellbeing. Principle 2, the right to self-determination. Now, self-determination is central to the provision of Aboriginal and Torres Strait Islander healthcare, and focus should be on the collaborative approach to address the holistic functioning of communities and families at the end of life, to ensure that it's a right to die on country and the lands that matter most to each person. And we need to prioritise facilitating this. To focus on the collective aspects of self-determination and address end of life through cultural continuity. And it's time we spotlight and address this now in palliative care. Principle 3, the need for cultural understanding. Culturally valid understandings must shape the provision of services and must guide assessment, care and management of Aboriginal and Torres Strait Islanders. This is essential for holistic care initiatives. There is a need to use terminology and communication strategies that are accepted and appropriate to the health literacy and objectives of Aboriginal and Torres Strait Islanders themselves. There appears to be a general lack of understanding and awareness of palliative care for individuals, families and communities in this population. And barriers exist in the use of medical terminology and jargon, impacting on engagement and appropriateness of current palliative care services. The need for cultural applicability and understanding to gain cultural acceptance of palliative care is also needed. To address goals of hope throughout the disease burden, educating community and family, discussing the fear of hereditary factors and predispositions of poor health and illness that has been spotlighted over many, many years now, addressing the social inequalities and the acceptance of poor prognosis, and also the spiritual and re-traumatising factors for family and their implications for coping at the end of life also need to be addressed. Principle 4, the impact of history and trauma and loss. It must be recognised that the experience of trauma and loss present since European invasion are a direct outcome of the disruption to our cultural wellbeing. Trauma and loss to this magnitude will continue to have intergenerational impacts across the healthcare sector. Palliative care strategy needs to harness healing approaches through methods that are embedded within cultural ways of doing, knowing and being, such as narrative therapies, clinical yarning and storytelling, and trauma-informed practices are needed at all levels of palliative care delivery to ensure culturally safe and competent planning and practice. Principle 5, the human rights of Aboriginal and Torres Strait Islander peoples must be recognised and respected. And failure to respect these human rights constitutes continuous disruption to mental health and wellbeing. Creating access to care that is culturally and emotionally safe provides respect for cultural diversity. It actually ensures a sense of power balance, governance and control over decisions and care pathways, actively involving the individual, families and community in all end-of-life healing and recovery journeys. Principle 6, the impact of racism stigma. Racism stigma, environmental adversity, social disadvantage constitutes ongoing stresses for individuals, families and communities at the end of life for Aboriginal and Torres Strait Islanders. Asking for financial, coping, emotional or social support can be shaming and stigmatising, forming an intersection to racism and stereotyping. Discussing these issues also can play a risk of being ostracised from community and family due to those deep emotional and social detriments. Past negative experiences and stories of past mistreatment such as shame, mistrust and discrimination, feelings of being stereotyped from non-Aboriginal Torres Strait Islander staff, the anxiety, the stress and the fear, as well as the non-disclosure of symptom burden. The needs and concerns are also known barriers for us to address and consider at the end of life for Aboriginal and Torres Strait Islanders. Principle 7, the recognition of centrality of kinship. The centrality of kinship of Aboriginal and Torres Strait Islander family and community must be recognised, as well as the broader concepts of family bonds, of reciprocal affections, responsibilities and sharing. Social and emotional well-being at the end of life is enriched by several interconnected domains: the body, the mind, the spirit, the emotions, family, country, community, relationships, responsibility, purpose, kinship and law. And these factors all extend to include connections to family, connection to the spirit and the country. And this emphasises the core of identity, that sense of belonging, that resilience, those obligations that exist, and it helps us with define our perspectives. The greater achievement of knowledge, coping, values and purpose that are significant to address in preparation for us to enter the dreaming. Principle 8, the recognition of cultural diversity. There is no single Aboriginal or Torres Strait Islander culture or group, but numerous groupings, languages, kinship and tribes. There really is no they. There are copious ways of living, knowing, being and doing, currently living in rural, remote, regional and urban areas. There are traditional, there are modern and mixed lifestyles, values and beliefs. There is no they. At the end of life, there is fluidity and transience across these settings to seek connection, support, belonging and reclamation, to pass on knowledge and to reconcile. There could be a need to go walkabout to find this final identity and connection across many lands, showing further significance of the need for us to advocate and be flexible. This means that in order to have a right to die on country or lands that matter, could be one specific country. It could change many times in our journey, end-of-life journey, as connection and disease burden changes, as family support and re-traumatisation from carers, communities and families are impacted by this significant grief, lost and past wounds. And Principle 9, recognition of Aboriginal strengths. It must be recognised that Aboriginal and Torres Strait Islander people have great strengths. They are creative, they are so enduring, as well as having a deep understanding of the relationships between human beings and the environment. Palliative care for Aboriginal and Torres Strait Islanders is palliative care for families and community. It is palliative care that empowers self-determination. It is palliative care that creates power balance to increase confidence and self-esteem. It should be palliative care that contributes to a powerful sense of community and holistic well-being. This builds resilience, it builds pride, and it solidifies aspects of identity. We as clinicians should be planning care to assist in both acknowledging, understanding, and facilitating this right to die on country or lands that matter. Dying on country or lands that matter to each person are lands that are strongly connected. Aboriginal and Torres Strait Islanders' connection to community, their ancestors, strengths, and family. And we can achieve this by developing relationships of trust and communication, by being genuinely accepting of the diversity that exists, by delivering flexible care and removing that they mentality. To ensure our Aboriginal and Torres Strait Islanders are not continuing to be an endangered species within palliative care, it is therefore essential that we change that they mentality. Remember, there is not one size fits all approach. There is no, they don't like eye contact, they don't like to use morphine, they like to wail, they have smoking ceremonies, they are uneducated and they won't understand, just to name some of what I have experienced even in just the last weeks. Please be inquisitive, ask about each Aboriginal and Torres Strait Islander uniqueness and re-ask throughout the care journey. It changes as disease burden, as stress and grief and circumstances change. And lastly, and most importantly, be captivated. Open your eyes to the history and the knowledge of our amazing Aboriginal and Torres Strait Islanders and their beautiful and individualised stories. Let's work together united to facilitate and ensure the right to die on country and on the lands that really matter. Thank you.
Kat, thank you so much. You are such an inspiration and an advocate for this space. So really, just a lot of gratitude to you and that amazing presentation. And there is a note in the chat. This will be recorded and shared so that you can share it with a lot of other people as well. So now I have the privilege of introducing Mark. Mark is the Executive Director of Palliative Care South Australia. where he's been based since July 2019. He's been involved in the Gwendolyn project with Palliative Care South Australia, acting as a partner with AgPal to run the National Palliative Care Project, focusing on the training on palliative care for Aboriginal health workers. He helped to develop the Palliative Care Australia film, Final Footprints, and has been sitting upon the PCA Reconciliation Action Plan Working Group as the PCA develops its most recent Reconciliation Action Plan. Prior to moving to Palliative Care South Australia, Mark worked for 8.5 years as the State Manager for Reconciliation South Australia, where he contributed to the reconciliation movement across South Australia. Reflecting upon his time in working with Aboriginal and non-Aboriginal people, Mark sees the highlight as developing a cutting-edge anti-racism program for schools, being part of building the Aboriginal and Torres Strait Islander War Memorial, growing reconciliation events, and leading a group of 30 in a reconciliation trek on the Kokoda track in 2017. Mark has been a strong advocate of consumer participation in health and helped to establish the Health Consumers Alliance in South Australia. He trained as a social worker and spent years working in the frontline youth work, including street work, or youth health work, mental health services, employment services, community drugs and alcohol work management. Mark has also focused upon workforce development, training, standards, and quality service delivery. He is a life member of South Australian Council of Social Services. So I'm delighted to introduce you now to Mark. Thank you.
Thanks, Charla, and thank you, Kat, for acknowledging the land on which you're gathered today, and also your comments about the healing that is needed in this land. I'd like to recognise Kaurna elders past, present and emerging, and I also recognise the cultural authority of other Aboriginal and Torres Strait Islander peoples from across the land who are watching this broadcast. I think also we should recognise that Amy is in Christchurch across the ditch, so it's good to have her on board too. What a week it's been. A new Australian government committing to take Australia to a referendum to embed the First Nations voice into the Constitution. Tomorrow is the 5th anniversary of the Uluru Statement of the Heart being read for the first time. And the last paragraph in that statement encourages all Australians to go on a journey, trek across the land to recognise voice, truth and treaty. I think that's a commanding statement for us all. Tomorrow is Sorry Day, and it's the 24th anniversary of the Bring Them Home report being tabled. And there are still members of the stolen generations who have not received reparation or have not been duly recognised. The apology was significant, but there's still work to be done. And then on Friday, we approach Reconciliation Week with the 55th anniversary of the 1967 referendum. And I truly think that we can do it again. Having worked in Reconciliation SA and also in palliative care, I see that I continue to be a learner in engaging with Aboriginal peoples and communities, and I still have so much to learn. Yes, I have some experience in developing reconciliation action plans and engaging with communities, but it's a reminder to me that I need to daily keep working at not making assumptions, keep listening and really wanting to truly engage with people. Today I'll cover comments on some of our local action and activity, and that I certainly would like to look at some of the Palliative Care Australia projects and comment on the national projects as well. Palliative Care South Australia has engaged with communities and Aboriginal health workers to look at ways in which palliative care can be improved and access increased across South Australia. The 2019 AHA report described enablers and barriers to access for palliative care, and we've tested some of those enablers and barriers in South Australia. In the process, we know that it's critically important to engage with Aboriginal community-controlled health organisations as well as Aboriginal health units within mainstream health services. These linkages that we made led to a meeting of stakeholders in October 2020, and that's continued to inform our work. One of the current projects in South Australia in development is support for a model or models of care for Aboriginal peoples with palliative care in South Australia. This project has employed an Aboriginal project officer and has established a strong advisory committee with key Aboriginal stakeholders involved. They're currently working in consultation across the state and going into communities. There's 39 language groups in South Australia, so trying to get some coverage into other areas. That I'd like to recognise the work of Lexa Wheatra, who is the project officer employed, and Cindy Parter-Cooper, who's helping to steer the advisory committee, and the work of the Central Adelaide Palliative Care Service in administering the program and supporting the program. It's also received funding from the Hospital Research Foundation, so it's been quite a good exercise of bringing state and philanthropy together. Both Lexa and Cindy presented last week in the beginning stages of where they've come to in the development of the model at our virtual conference last Friday. And I'm really looking forward to seeing the outcomes of this project. Palliative Care South Australia continues to build contacts and connections with Aboriginal peoples and also with Aboriginal health workers through forums and attendance at events such as the Close the Gap Expos. Over the last couple of years, PCSA was really pleased to have worked with Palliative Care Australia in managing the filming of Final Footprints, which Shyla mentioned, and that was launched in NAIDOC Week 2021. The panel discussion that accompanied the launch of that film included Kat, so it's good to have you back on the same platform, Kat, Cindy Parter-Cooper and Jonathan Jauncey. I can really recommend that you look out the film and have a look at it, and if you can get the extended panel session version as well on the Palliative Care Australia website, it's worth having a look at. I've also participated, as Shyla said, in the Palliative Care Australia's RAP working group, the Reconciliation Action Plan working group. And PCA has chartered a 6-year development process that will move them from the current Reflect RAP, which was endorsed last year, into an Innovate RAP, and then aspiring towards a Stretch RAP, so that progressively they're looking to do the work to get the cultural fitness to be able to employ Aboriginal staff, to be able to engage in Aboriginal communities and appreciate the work that needs to be done in this area. It's really been quite pleasing to see PCA's RAP come to fruition. But obviously, I'm a little bit of a Reconciliation Action Plan heretic. I think that the words on the page are great and the look of Reconciliation Action Plans are important as symbols. But if we do that without action, for me, it's all about the follow through. And that's the important thing in the Reconciliation Action Plan area. And as a national organisation with members across the country, Palliative Care Australia has the opportunity of supporting and influencing other states and jurisdictions in looking at reconciliation action plans. And some, like Palliative Care Queensland, will develop their own reconciliation action plan. For us in Palliative Care South Australia, being such a micro organisation, we've chosen to sign up to the PCA RAP and report against its activities. And the critical step for us is to build a local advisory group in that process. As part of Palliative Care South Australia, we manage the PEPA program, and I'm totally committed to the iPEPA part of the program of experience in the palliative approach. And we aim to employ staff and actually start to make some significant inroads into education for Aboriginal health workers through PEPA. But about 3 years ago, we partnered with AgPower, the Australian General Practice Accreditation Limited, and were successful in winning a national project out of which Gwendolyn has been born. And Kat's already mentioned Gwendolyn. It's important, I think, to get to look at those resources. There's 5 modules online. There's a dilly bag of goodies there that you can go and actually look at and delve into. And the last 2 years in COVID, much of the time has been spent in developing those resources. But this last year of the project is really critical in road testing the training that's attached to the resources. I think we really should be supporting. We aimed at 20 consultations, training programs across the state targeted at Aboriginal health workers, and I really want to see that come to fruition this year. In closing, I have got a wish. You'll see that I'm wearing a conference t-shirt from 2019, the Dying to Yarn conference in Queensland, which was a state-based model, but some of us from around the country attended. I think that this is a model that can be replicated in every state and territory, and it can actually help to focus and harness the networking, some of the good practices that are happening, some of the interest amongst elders to actually improve palliative care. So my wish is to see that the resources are secured in South Australia. That's obviously my jurisdiction, but it'd be good to roll it out around the country. I'd like to thank Palliative Care Queensland in holding today's webinar. I see it as a really significant event in highlighting palliative care for First Nations people. We recognise that this week's theme is palliative care at your right, and I really want to pat Shara and her team on the back for going out there and saying, well, today's message is people have got the right to die in country and lands that matter to them. Thank you.
Thank you so much, Mark. I think so much was shared and acknowledged in that presentation. I think particularly the angle of it's not just about the promise and the documents, it's about the action. And I think that's so critical in this space. And I hope something that everyone gets out of today's session is what can you do next? Let's keep moving forward collectively together to make a big difference. I think both of you have really been such an inspiration to listen to and learn from. So thank you. So now I've got a chance for your turn. Any questions that people have? So there's a Q&A button there at the bottom of the screen, or maybe somewhere else if you're on another fancy device. And so pop them in there. We do have one already. So I might ask this first to Kat. So would like to understand how practitioners can support the informal carers, support people who are part of care at the end of life. Over to you, Kat.
Oh, that's a great question. And I think it's really important to make sure that we're engaging with a lot of the community. So making sure that we're aware of some of the elders and support systems that exist in our communities. And also, I think, understanding the significance of the Healing Foundation. What we are finding at the moment is that there's a lot of re-traumatisation. So when our Aboriginal and Torres Strait Islander carers are caring for their loved ones, it's actually re-traumatising their previous losses and things that they hadn't explored, or bringing up a lot of emotion. So there is some beautiful support out there. I think that's a really big one, is linking in with your Healing Foundation. And as I said to you in my presentation as well, there's some narrative therapy and trauma-informed care. There's some beautiful online courses that you can do. And I think that's a really great place to start. Yeah, I'll have to find the link for that and post it up in the chat for you for the different places that actually offer those sorts of training. So yeah, that's a good place to start.
Lovely. Thank you so much, Kat. And we can also put those links in the email that we'll send out to everyone after, so you've got access to them for longer term as well. Mark, over to you for the same question.
Thanks, Charlotte. And I really do encourage people to put your questions in the Q&A down the bottom of the screen there. As part of the Caring at Home national project, we've been consulted in South Australia. Indeed, they've been going around the country to demonstrate that the tools that were developed for caring at home for the whole population could actually translate to caring at home for Aboriginal communities. And there's a huge amount of resources for carers that are about to hit the market in the coming years. So I'd encourage people to keep looking at the Southern Queensland project and the Caring at Home project that's been tailored towards Aboriginal peoples across the country.
Fabulous. Thank you so much. We haven't got another question out there yet, but I might just add something. So next week is National Reconciliation Week, and the theme is Be Brave and Make Change. I'll just ask you both, I'm putting you a little bit on the spot here, but ask you both sort of what are some key things that you think, following your discussion, that people could activate or do about being brave and making change in the next week or so? Over to you first, Kat, and then to Mark.
I think the most important thing to realise is that being brave, it starts with us. So from an Aboriginal and Torres Strait Islander point of view, it's just changing all of that systemic racism or that discrimination or any stereotypes that you might have, but just really honing in on the fact that being brave, it starts with us. So standing up. And as I've said as well, I can't advocate enough, like pop along to some of your local places and learn about your culture, learn about that Aboriginal and Torres Strait Islander culture in your own area, because I think that's really important, because it helps us to formulate ideas and understanding, so that's a really good starting point to communicate with Aboriginal and Torres Strait Islanders as well, just being informed of some of those barriers and facilitators that exist just in your local area. And, you know, it takes a lot of strength to change the way that we have addressed things for so long. And I think it takes a lot of strength and bravery to stand up when we hear racism and those sorts of things as well. And it's about trying to really create that equal power balance as well.
Thanks for the question, Charlotte. I suppose one of the things I cut out of my presentation, you know, there's so much to talk about in this area, is that as well as developing an anti-racism program in schools, in South Australia, we've been doing a lot of thinking around institutional racism in health. And I get really disturbed that very often the people who are consulted on addressing racism are the people who are experiencing the racism. Actually, it's for all peoples to stand up and deal with racism and call it and attend to it. And the institutional and systemic factors are different than the behaviours that are manifested within clinics or in communities. And so there's a tool out of Queensland that looks at institutional racism and measures how government departments and systems, health systems, are actually operating this area. And we don't come up very well. And so if we want to increase access to palliative care for Aboriginal people, Aboriginal and Torres Strait Islander people, there might be some systemic areas that need to be addressed. Who are we talking to? Who are we getting advice from? Who's leading the message? And I'm really clear that it's not up to me to lead that message. I think it's up to me to try to be part of leading the action that we hear is the recommendation. But I look for Aboriginal leaders and voices in this space like Kat to be going, here's something that you can do, here's something you can practically do. And that might be about representation, it might be about policy, it might be about the look of a clinic, it might be about you've actually got to go out of the hospital and into community more. Because if we're going to achieve dying on country more, we can't actually end up with the response of, oh, that's going to be too expensive. You know, if it matters, it matters. And so how do we actually take that on and address it and deal with some of those systemic issues?
Well said.
Just going to say that exactly. Well said. I think I'm going to use that phrase a lot more now. If it matters, it matters. I think that's so such a good way and simple way to articulate it. So we've got another question that says, are there any cultural beliefs about sedating medications that we need to be aware of?
So I think that sedating medicines, again, it's very much about the person and their journey, and it's about their own individual values and beliefs. I mean, they're like, even in Western culture, I think there's a strong resistance to access some of those medicines. I think we have a duty of care, though, like as clinicians, just to sit down as a starting point and just explain our rationale, because sometimes we're often quick to say the solution, but often we don't actually inform that solution with rationale. And I think that's really important, just to sit down and have a little bit of a yarn. And again, it's really about empowering people, because sometimes it could be just fear related, or sometimes it is a genuine disinterest in using those types of medicines, but also in allowing opportunity to use medicines like bush medicines and things like that, that our Aboriginal and Torres Strait Islanders may like to use in conjunction. I think they all have a role to play. And I think with a lot of the medicines, I think we've got to really try and target things again holistically. So looking at things emotionally, socially, spiritually, culturally. And, you know, there's lots of medicines that we use in palliative care that sort of target emotions, and they target our anxieties and things like that. So I think we can also use those same things and release those natural things in our bodies through, you know, distraction, and through things that we enjoy. We can release all those positive endorphins. So I think there really is an opportunity there just to hold that space as well when we're having those conversations, and just addressing why, asking the question rather than just assuming that there's a particular reason behind it as well. But again, don't have that they mentality, just making sure that, yeah, it is an individualised approach.
I haven't delved into it hugely, but I know in the office we've got a resource around morphine and the cultural views on morphine. I think it's a resource that comes out of the Cancer Council in Queensland. And so that might be worth having a look at. And there's no doubt that, as Kat said, the issues about views on medication are different in different cultural groups and communities, and so, and obviously different across heterogeneous communities as well. But I do think that sense of people being informed first, and then cultural leaders actually going, no, this is actually okay. That respected people being able to go, in these situations, morphine's all right. And that then there becomes an acceptance and a calming of some of the fears. You know, palliative care is so much about dealing with people's hopes and fears. It's not just about the medical side. It's not just about the medication. Kat highlighted the psychosocial aspects. And so really let's key into some of those questions about people's hopes and fears and allay the fears.
Yeah, and just one thing, that's beautifully well said yet again, Mark. And I think another thing to think about is also when we're talking about symptoms and things like that, that we can do it in so many different approaches. And at the moment, we're working really strongly on some storytelling and how to add the science into address how we use medicines, why we use them. And I'm hoping to do a little bit more work in that space. And I will also give some links to Shyla to send out to you all as well, that will link you into some of the stories that I tell in regards to symptoms and how to link it in with science to explain why we get symptoms and why actually we use the medicines we use and how they work from a physiological sense as well. So they're pretty cool stories.
I think we're going to have this huge resource email coming to everyone. There's so many great assets that you guys are sharing in this space, so thank you. And we will be sharing it with everyone in the email after. We have another question here, which is around how do we care for a First Nations person in a palliative way who has been brought up in a Western culture and does not have much insight into their cultural identity. Kat, I just thought we might talk about with this one. Kat was involved with our first Indigenous wish for Ambulance Wish Queensland, and I think the example of how you led that process for us answers this question in this way, and it was a real learning for all of our team to be a part of it. I'll put the link up in the chat for people to read the story behind it, just obviously recognising that it does have images and a storytelling of people that have passed away on there as well. But Kat, just wondering if you could talk, share a little bit about your experience of that wish process for a First Nations person, and it's a good example of that. You know, this is the way that you approached it differently than how we did it with others. So can I hand over to you about that?
Yeah, hopefully I answer it as well as you might, and please add. I guess it was about, at this point in time, I think first of all, we actually looked at the country first and where family actually wanted to go to. And we looked at what that actually meant to the family and the connection that was there. And once we actually got onto that country, it was actually then exploring different traditions and different aspects of taking that family back to that connection to country as well. And in regards to a smoking ceremony, it was, in this particular instance, again, it's so different across different Aboriginal and Torres Strait Islander culture. There is no one-size-fits-all model. But this particular family actually really wanted to, and the patient wanted to bed her feet down on country. So she wasn't able to walk really well. But one of the big things for her was to actually take her shoes off and plant her own feet on her own country and feel that connection. And then she actually wanted to have that smoke go through her hair. And she didn't want to wash her hair for a long time afterwards either, because it was the whole concept of the smoke that was from her country, from those native plants, that actually went through her hair and actually drew her spirit back to country. And so her spirit, when she finished up, actually knew where to go. And additionally to that, she had ancestors there. Now, they were parents and grandparents that were a part of those lands. And so it was really important for her as well to have that smoke and that sense of placing her feet on that country so she could mark her spot on that country, so that she would actually be reunited and reconnected to her family. So I guess the most important thing to realise, even through all of that, is that we all have a different story and a different message and behind the reasons that we practice our culture as well, and the symbolism of the different, things that we do, I guess. It's so individualised and so personalised. So does that help answer, Shyla?
Absolutely perfect. I think that was just a great example of when we, we fulfill wishes all the time, which are an amazing part of the program that we deliver. But what Kat, like she said, she really got in there and listened and understood the cultural significance of the wish and the want and the memories that are a part of it, and then taught them all to us as a team and to the team, the paramedics and everyone around. It was such a lessons learned. So I think that's part of this is you know, what you learn, share with others, you know, keep the stories going in this space, because our team still talks about that now because it was such a beautiful part. So yeah, and the story, you can see the images and the way that it was just a really big privilege to be a part of and achieve in that space. So thank you. I just recognise the time, and I know we could talk about this all day. It sounds like there might be a need for and lots more sessions, I think, in lots of different ways to connect. And Mark, I love the concept of you know, doing regular events in different areas as much as we can is so important. So keep that on everyone's agenda and really look how collectively we can work together. So just to wrap up, I'd just like to thank, obviously, Mark and Kat. How can I thank you both enough? You're such an inspiration, both of you. You're such great advocates for this space, and we really are grateful for all that you do in so many different ways. Kat, I have no idea how you find the time to do a PhD, work with this space, be an amazing parent and family member as well, and just such an advocate. So thank you for your time and committing to doing this morning. Thank you to our supporters and everyone else involved as well, and to all the jurisdictions and to PalCare Software as well. Most of all, thank you for attending, everyone. Thank you for taking the time, and for those that will watch this after and those that we share this with after in different ways. One way that everyone can support their local palliative care peak body is to become a member. So we've got links here to all the jurisdictional links to their membership, and we really encourage you all to get behind your local peak body for palliative care, so that we can continue to support people across our jurisdictions and to advocate for important messages such as today. So after this email, you'll receive after this session, you'll receive an email which will include a evaluation, a link to the online aspect of this. If you'd like a certificate of attendance for your CPD, please let us know by emailing us and we can send that out to you. Please complete the evaluation. I know everyone's really busy, but if you could do that, would just be wonderful. And please share this with other people. The messages shared today are so valuable and so important. And I think it's just really important that we keep this message going. Don't forget, please engage in National Reconciliation Week next week. And I think the key take-home message for me today is, if it matters, it matters. So everything that you learnt today in that space, take it forward. And I think what Kat mentioned, be inquisitive, ask, don't make assumptions, listen and advocate. So please keep that up, and thank you everyone. Thank you again, and have a beautiful rest of the day. Happy National Palliative Care Week.
Thanks, Shyla and Mark, you're amazing too.
Well done, Kat.
Thanks for all your hard work, hey?
Thanks everyone.